Imagine a tranquil silence, unexpectedly shattered by a persistent, high-pitched sound that only you can hear. In this introductory segment, we will dive into the world of tinnitus, a condition experienced by millions around the globe. Though often benign, tinnitus is not to be ignored. Join us as we unravel the mystery of this auditory phenomenon, understand its potential causes, and discuss its impact on day-to-day life. Attunement to your auditory system signals is critical for your overall health and wellness. Tinnitus is a curious condition, defined by perceiving sounds without any external source. Characteristically experienced as a ringing in the ears, especially in the high frequencies, it can also appear as buzzing, hissing, or whistling. In this segment, we will dissect what tinnitus is, its varying intensities, its close link to hearing loss, and how it ranges from a short-lived irritant to a persistent burden. Understanding tinnitus is the first step in effective coping strategies and diminishing its presence. The triggers that initiate tinnitus are diverse and multifaceted. From the damage dealt by loud noises to age-induced hearing alterations, earwax buildups, earbone changes, cardiovascular complications, and even psychological anxieties. With the exact cause often being a complex puzzle, this segment will concentrate on unveiling these common initiators. Understanding such triggers is instrumental for diagnosis and devising appropriate treatment plans. In this segment, we explore how tinnitus can seep into the quiet moments of life, upending daily routines and interfering with focus, sleep, and emotional balance. The relentless, often irksome sounds can lead to a social withdrawal effect, overshadowing one's ability to perceive environmental sounds. We will discuss the imperative need to address tinnitus in its early stage to mitigate its ramifications on both personal and professional realms. Tinnitus does not present uniformly. It varies in behavior from person to person. This part will investigate whether it's a constant noise or an episodic one, pulsed with one's heartbeat or affecting one ear over the other. Recognizing these specifics can equip health professionals with valuable insights. Join us as we delve into recognizing the patterns in your tinnitus experience and what those patterns might signal. Every tinnitus sound carries potential clues regarding its origin. In this segment, we embark on a clarifying journey to classify them. A high-frequency tone could hint at noise-induced hearing loss, while lower ones might indicate different conditions, such as Meniere's disease. We will also discuss the significance of pulsatile tinnitus and how these descriptions aid in medical evaluations. Identifying whether tinnitus is a fleeting encounter or a long-term guest is crucial for managing your auditory health. This part of the script examines the differences between temporary tinnitus, usually following sudden loud noise exposure, and chronic tinnitus, which lingers beyond the 6-month mark. Determining the nature of your tinnitus is imperative for appropriate medical attention and therapeutic intervention. Beyond auditory disturbance, tinnitus can take a significant emotional toll on individuals, birthing anxiety, frustration, and depressive episodes that can aggravate the condition. In this segment, we will dive into the psychological realm of tinnitus and underscore the equal importance of emotional management as part of a holistic treatment approach. We'll explore the techniques and resources available to handle the mental effects of this complex condition. While tinnitus is often non-threatening, there are scenarios when a high-pitched ringing serves as a health alarm, which we will discuss in this segment. Accompaniments like sudden hearing loss, dizziness, or headaches necessitate urgent medical intervention. We'll focus on when tinnitus transitions from a mere annoyance to a warning sign pointing towards more serious conditions, such as an acoustic neuroma or vascular complications. This part will analyze the combination of high-pitched ear ringing with a noticeable hearing decline. As hearing loss can stealthily creep in, we will discuss the importance of recognizing these symptoms in tandem. We aim to highlight the conditions such combined symptoms might suggest, including otosclerosis and noise-induced auditory damage, stressing the critical nature of early detection for effective management. When tinnitus isolates itself to one ear, it raises unique concerns. This segment sheds light on unilateral tinnitus and its potential implications such as Meniere's disease or an acoustic neuroma. We discuss the urgency of medical assessment and how early diagnosis can significantly impact treatment outcomes and, ultimately, patient well-being. Tinnitus can be a symptom of a wide range of health disorders, an issue we'll unpack in this part of our exploration. We will delve into ear-related conditions like infections, Meniere's disease, earwax blockages, and neurological conditions that may manifest as that high-pitched ringing. Furthermore, the script traverses the risks associated with ototoxic medications and underscores the need for thorough analysis to uncover these health concerns. In this segment, we explore otologic problems, ear disorders that are frequent triggers of tinnitus. We'll dissect how tinnitus may follow a middle ear infection or become more permanent with chronic conditions. Among these, we'll highlight Meniere's disease, characterized by symptoms of tinnitus, vertigo, and fluctuating hearing loss. The focus will be on the importance of early detection and the approaches for managing tinnitus and preserving hearing health. Neurological factors occupy a distinct position in the world of tinnitus, and these form the core of our narrative in this segment. Benign tumors like vestibular schwannomas epitomize causes of unilateral tinnitus, while multiple sclerosis and migraines further illustrate neurological origins. We'll delve into how these conditions call for tailored approaches and underpin the importance of swift identification and specialized care. Medications can have unintended side effects including ototoxicity, a phenomenon that may birth high-pitched ear ringing. In this segment, we explore drugs like certain antibiotics, chemotherapy agents, diuretics, and NSAIDs that hold this potential. We will discuss the importance of monitoring new medications, considering dosage adjustments, or making changes, all with the ultimate goal of alleviating the ringing. When confronted with consistent tinnitus, the medical community relies on a range of diagnostic tools. This part examines the journey across audiological evaluations, including pure tone audiometry, speech recognition tests, and tympanometry. The narrative here aims to highlight how these tests assess hearing loss, pinpoint its extent, and inform treatment strategies, illuminating a path through the darkness of tinnitus.